This is a message of solidarity with the junior doctors who are quite rightly raising very deep concerns about the kind of contracts which are being foisted upon them. First of all, contracts should be negotiated in good faith and without precondition. And secondly, I think the Secretary of State should treat junior doctors as the committed professionals that they are. They really are the backbone of the NHS. I'm deeply concerned that the contracts that Jeremy Hunt has in mind are both unfair and unsafe. I think what we need to do is to make sure that doctors are properly remunerated for the work that they do, recognising that working Saturdays, working late evenings is not the same as working during the day, and it should be recognised as such in the pay that is given for that work. We need to recognise too that doctors already work 7 days a week, certainly when there's emergency care. And if Jeremy Hunt wants to extend that to all kinds of medical practice, elective care as well, then it's not just a case of doctors working 7 days a week. They would need social care packages, pharmacists and many others to work 7 days a week as well. So I think what we need to bring to these negotiations is from the Secretary of State a greater respect for a committed profession who already work well over their hours to take care of the patients that they look after with such dedication. I've put down an early day motion that I hope MPs will sign to send a very clear message to the Secretary of State to say that unless we have better relations and respect our doctors, then even more of them will begin to leave the profession. There is already a very real risk that we are losing dedicated doctors to other parts of the world, to other professions. We need our doctors. They want to work for an NHS, a public NHS, an NHS that they can be proud of, and the Secretary of State has a duty to provide it.